And then it's gonna stay relatively about the same area. I'm gonna use the greater trochanter as my axis point. Use the lateral epicondyle of the knee, of the lateral condyle. I'm gonna use the axillary line. All right. This is, see how I got his knee bent? That way I can take out the passive insufficiency of his hamstrings. That way I can see what the hip can do. If I were testing his flexibility, I would keep the knee straight and activate the passive insufficiency so I could see, I could test muscle length. All right? So, what I want you to do though is hip range of motion, not hamstring length testing. All right? So, now again, you can scratch your head and pat your belly at the same time if you like. No, bend that.
My bad. I was scratching my head, patting my belly.
All right, you can do that if you like. Or what you can do is say, all right, can you hold that up there for me?
With my hand?
Yeah, just hold it there. There you go. Greater trochanter right there. That looks about right. My 0 is right here. I'm reading, what, 112?
Yeah. Roughly.
Easy peasy, lemon squeezy. Yeah?
Yep.
All right, while we got him here, let's do abduction. Scoot this way just a little bit. There you go. All right, just like yesterday. The reason why I scooted him that way is because I'm going to bring him out this way. All right, so I wanted to have plenty of room.
It's just instinct. I just want to know where to go.
I'll leave your damn leg down.
Okay, go.
All right, so this one we're going to go ASIS. Our proximal arm, our fulcrum goes on the ASIS of the leg we're measuring. Proximal arm or stable arm points to the other ASIS. This one's going to require you to do some math because your 0 is 90. This goes down the femur using usually the superior pole of the patella. All right. Now, some compensations that will happen is we don't want him to externally rotate. Okay. So, again, you can scratch your head and pat your belly at the same time. Do that. Or I prefer to
I'm going to move over here.
go ahead and position him. Relax. Relax.
That's on my back.
Will you relax?
I'm sorry. I'm under a lot of pressure right now.
So 90 was my 0. That's what the red marks are for. So it's greater than 20, less than 40. So it's 25 degrees. 10, 25. See that? All right. Now some compensations that will occur.
Yep.
See how he's starting to bend his trunk now? Okay. So that's when they start bending the trunk, that's when we say stop. Okay. Unless they tell us to stop first. Adduction. We use the same leg, scoot toward me. Is the same landmarks, same everything, but we're going to clear some space. ASIS to ASIS on the femur. And we're going to adduct him to measure that.
So you
Again.
can move this one?
I had to clear it out of the
Oh,
way.
okay.
Otherwise it would go boonk right to 0. It wouldn't go any further. So I clear the opposite one out of the way. And again, the compensation is when the ASIS start to dip, that means the trunk is tilting and we want to stop. Hip extension. on your belly. This one is one that is good to garner help with because we're going to use the same landmarks as we did for flexion. So for this time, we want to keep the legs straight so we don't activate the passive insufficiency of the rectus femoris. See what happens, relax. Now, if I do this, I'm stretching the rectus femoris across the knee and the hip, and I get an idea for the length of the rectus femoris, but I'm measuring what the hip can do, not the length of the rectus femoris. So, somebody care to assist?
What you need me to do?
Put that leg up, keep his knee straight. Okay. See how you roll?
Yeah.
Okay, so bring it up until he starts to roll. Right there. Greater trochanter, mid-axillary line. This time I'm going to use the lateral, still using the lateral epicondyle. And I'm getting 11 degrees. My 0 started here. I'm getting 11 degrees.
So would it be the same, like, documentation wise as labeling it as hyperextended?
No, these will always start at 0. The only two that we start are 13 to 0 to whatever is the two hinge joints, the knee and the elbow. Everything else is 0 to whatever. So you document hip, passive range of motion, flexion 0 to 22, extension 0 to 12, abduction 0 to, what do we get, 25, adduction 0 to 12, whatever. Now we do internal and external rotation. Set up on the edge, please. Right. So, if the foot goes in, that's external rotation of the hip, right? Okay. This is where most of you will screw up. Is you'll get your internal, you'll get the measurement right, but you'll label it wrong. This is external rotation because it's.
Watch what the knee does
Yes.
instead of the foot.
This is internal rotation. Now, see the compensation he just did? Watch what he does if I take him too far. Right? See how he comes up off? We gotta have him sitting straight like that the whole time. That's as far as it wants to go right there. Probably cramping, didn't it?
My hip don't move very well.
No kidding. I haven't noticed.
I'm working on it.
All right, so what I'm gonna do is I'm gonna go right there about the inferior pole, because that's gonna put me, if this is my femur, it's gonna put me right about there. And that's what we're measuring, is the rotation of that femur. Now, I can't remember if the book says to go perpendicular to the floor or perpendicular to the ceiling. I honestly don't care which one you do, whichever one you can measure it the best with. I like to go to the floor because I can see that better. It's a shorter distance from the floor to my goniometer than from my goniometer to the ceiling. So, here's where you need to garner a little help. You can always, again, pat your head and scratch your belly. Do that if you want. But what I like to do is relax. Just use my own leg to help myself out. Now I can take my time and get my landmark straight. Distal one is going down the crest of the tibia. And I'm getting, my 0 is down here, so I'm getting 40 degrees.
And that one's supposed to be 45?
He's tight in his hips.
Is it known that, like, women have more movement in their hips than men?
Women generally have more movement in every joint than men do.
Is that because we have more musculature?
Do what?
Is that because we have more musculature?
Musculature's got nothing to do with it.
Really?
I
No.
bring you back to Jean-Claude Van Damme again.
But
Monica.
Who is very muscular, but is yet very limber.
Yeah, I just remember something earlier about the inverse relationship between stability and motion.
Mobility.
Mobility, so I assume more musculature would make you more stable in a joint.
I think it has to do with more with ligament capsular laxity in women than it does men.
I was thinking like with the hips, with like childbearing and
Oh,
stuff.
yeah.
This is total guess. I would posit that women who've had children probably have more range of motion in their hips than women who haven't had children. In general.
Well, we'll see today. That's very true. We can make our own experiment.
When I do internal rotation, my landmarks are the same. This time I'm going to use this leg to help me out. There we go. That's better. 0 is right here because I went perpendicular. And I'm getting, what, 28?
yeah.
And that's how you do the hip, goniometry.